Hello, my name is Celeste Bostic, and I am the Program Lead for the Skilled Nursing Facility Value-Based Purchasing Program. I will be providing a step-by-step explanation of how to read the SNF VBP Annual Performance Score Report. During this training, we will review the information included in the Annual Performance Score Report, discuss how to interpret patient and facility level data contained in the Annual Performance Score Report, and identify the information that is subject to Phase 1 and Phase 2 review and corrections. The Performance Score Report is an Excel document that facilities will retrieve from the Certification and Survey Provider Enhanced Reporting, or CASPR system. Facilities will notice that the format of this report resembles the quarterly reports that have been issued to SNFs for the past few years. However, this annual report contains 4 tabs of information, which we will cover in this training. Tab 1 is a cover sheet. Tab 2 contains a complete list of calendar year 2017 eligible stays. Tab 3 contains facility-level data, and the 4th tab is a data dictionary. SNF VBP performance scores are based on the Skilled Nursing Facility 30-Day All-Cause Readmission Measure, or SNF-RM. This measure assesses unplanned hospital readmissions rates for Medicare beneficiaries within 30 days of discharge from a prior proximal hospital stay. SNFs that admitted Medicare patients during the performance period will receive a PSR. SNFs that did not have any eligible stays or Medicare patients during the performance period will not receive a report and will receive a federal adjusted per diem rate that it would receive absent the SNF VBP program. Now let's begin with Tab 1 of the Annual Performance Score Report. Tab 1 of the report is a cover sheet that provides a summary of the information contained on Tabs 2, 3, and 4 of the report. At the top of the cover sheet, the performance period and baseline periods that the report includes are displayed, as well as the SNF's name and CMS certification number, known as CCN. We will discuss the remainder of the information on the cover sheet throughout this training. Now let's move on to Tab 2. Tab 2 of the Annual Performance Score Report provides a complete list of eligible stays used to calculate the SNF's Risk Standardized Readmission Rate, or RSRR, which is the SNF's rate of unplanned readmissions during the calendar year 2017 performance period. As a reminder, SNFs have an opportunity to submit Phase 1 review and corrections requests by March 31, 2019, to the information that will be made public, which will be the calendar year 2017 RSRR. Facilities must email SNF VBP inquiries at cms.hhs.gov with the subject line SNF VBP Review and Corrections Inquiry, along with the CMS certification number, the SNF's name, and the correction being requested with the reason for the request. Now let's walk through the information found on Tab 2, the Eligible Stays tab. There are 5 groups of patient-level data on this tab, which we will take a moment to review. The first group shown here are patient characteristics in columns C through E. This information is pulled from Medicare Part A fee-for-service claims. This information is provided to SNFs as a way to identify which Medicare patients were eligible and included in the measure calculation. These patients will be included in the denominator when calculating this measure. If an error is identified in the information presented in these columns, the facility should follow the established claims corrections process. The next group of information is the index SNF information, columns F through H. This information is provided to SNFs to identify when this patient was admitted to the SNF. The discharge date is not used to calculate the SNF-RM, but is provided to assist SNFs with identifying the patient listed in the report. The discharge status code is used to determine the reason the patient left the SNF. For example, if the patient left the SNF against medical advice according to the SNF claim, this patient would be excluded from the measure. Again, we pull this information from SNF claims. If an error is identified in this section, SNFs must follow the established claims correction process. The next group of information is prior proximal hospital information, columns I through L. In these columns, the hospital CCN, admission date, discharge date, and principal diagnosis of the prior proximal hospital stay are provided. This information is pulled from the claims submitted by the hospital where a patient was admitted prior to SNF admission. The prior proximal hospital discharge date is used as the beginning date of the 30-day risk window used to determine whether the patient was readmitted to a hospital within 30 days. The next columns are the hospital information where the patient was readmitted, columns M through R. If the patient was readmitted within the 30-day risk window, the hospital CCN, admission date, discharge date, and principal diagnosis of the stay at the readmitting hospital will be provided. This information is pulled from the claim submitted by the readmitting hospital. This is where a planned or unplanned readmission is noted according to the technical specifications for this measure. The remainder of the columns in the report contain the risk adjusters used to calculate the SNF-RM, since this is a risk standardized measure. This means that the measure accounts for differences in SNF's patient demographics and clinical characteristics. Columns S through KK of the performance score report show the patient characteristics used to risk adjust the risk standardized readmission rate, or RSRR, such as length of stay and principal diagnosis. This information is pulled from hospital claims. It is important to note that any corrections to the information found on this tab must complete the claims correction process in order to be included in the calculation of the SNF VBP measure. Now that we have covered the patient-level information found on Tab 2 of the Performance Score Report, let's move on to Tab 3. Tab 3 displays facility-level data, including the SNF VBP Performance Score, rank, and incentive multiplier that SNFs will receive for the fiscal year 2019 SNF VBP program. Again, SNFs have an opportunity to submit Phase 2 review and corrections to their SNF VBP Performance Score and rank up to 30 days following when this report is made available by again emailing SNF VBP inquiries@cms.hhs.gov. Here's an example of Tab 3 of the Annual Performance Score Report. The information in this table is not actual facility performance. This information is example data. This tab contains the following important information about each SNF's performance for the fiscal year 2019 program. Row 6 contains the calendar year 2015 RSRR. This is the readmissions rate, or RSRR, during the baseline period used to determine SNF's improvement score. Row 7 contains the improvement threshold, also known as the baseline period inverted RSRR. This inverted RSRR is compared to the performance period inverted RSRR to determine improvement. Row 8 contains the SNF's calendar year 2017 RSRR. Remember, only this row falls under scope for Phase 1 review and corrections. This is performance during the performance period. Row 9 contains the performance period inverted RSRR. We invert this rate by subtracting it from 1 to compare it to the achievement threshold, improvement threshold, and benchmark. Rows 10 and 11 contain the fiscal year 2019 achievement threshold and benchmark. These values were provided in the fiscal year 2017 final rule and are used to set performance standards and in calculating your facility's achievement and improvement scores. Rows 12 and 13 contain fiscal year 2019 achievement and improvement scores. The improvement score is calculated based on how much the SNF's performance improved compared to the baseline period. The achievement score is calculated based on the SNF's performance in the performance period, calendar year 2017. Row 14 contains the SNF VBP performance score. The performance score is simply the higher of the achievement and improvement scores. This score is used to calculate the SNF's rank and incentive payment multiplier, which will be applied to fiscal year 2019 Medicare payments. Row 15 contains the SNF's rank. The rank is based on the performance score. The best performing SNFs receive a rank of 1, and SNFs with the same performance score will receive the same rank. Row 16 contains the incentive payment multiplier. This is the net multiplier that will be applied to claims submitted for services provided during the fiscal year 2019, beginning October 1, 2018. Remember, only rows 14 and 15 fall under scope for Phase 2 review and corrections. Now that we have discussed Tab 3, let's move on to the final tab, which contains the data dictionary. Tab 4 of the Annual Performance Score Report provides descriptions of the data elements or variables we just reviewed on Tab 2 and Tab 3. The data dictionary for Tab 2, which contains definitions for the eligible stay data contained in columns B through KK in Tab 2. We have provided definitions for each variable contained on Tab 2 of this report. We will not walk through each definition, but would just like to note that this dictionary is here to help facilities better understand and review their reports. The next table contains definitions for the facility-level data in rows 6 through 16 of Tab 3. Definitions are provided for each variable and again are provided to help facilities better understand and review their reports. Here we have the screenshot of the bottom portion of the Tab 3 dictionary. As a reminder, the data in rows 14 and 15 fall under scope for Phase 2 of the review and corrections process. Again, we would like to note that SNFs with the same performance score will share the same rank. SNFs with the highest performance scores of 100 will be ranked at number 1. Also, the incentive payment multiplier will be applied to your SNF's adjusted federal per diem rate and will be reflected on your claims. When making payments to SNF's claims, the adjusted federal per diem rate will be multiplied by this factor. To summarize what we discussed during this tutorial of the SNF VBP Performance Score Reports, we reviewed the patient and facility level information that will be included in SNF reports. We reviewed the Phase 1 review and corrections process for submitting requests about the information that will be made public, which will be the calendar year 2017 Risk Standardized Readmissions Rate. We also reviewed the Phase 2 review and corrections process for SNF performance scores and ranking. As a reminder, please do not email protected health information or other sensitive patient information to the SNF VBP inquiries@cms.hhs.gov mailbox, as it is not secure to receive this type of information. If SNFs are unsure about the information being sent to the mailbox, please contact your institution's privacy officer prior to emailing your corrections request. Please also note that the performance score report is in read-only format to avoid unintentional changes. We hope this training is helpful when SNFs are reviewing their reports. For more information about the SNF VBP program, visit the link on the screen. For information on how to access your report through the Certification and Survey Provider Enhanced Reporting or CASPR system, please view the Accessing Your Quarterly and Annual Reports tutorial on the SNF VBP website. Please contact the Help Desk at help@qtso.com for any additional concerns around accessing reports in Casper. If you have additional questions, please email the SNF VBP mailbox. Thank you for viewing this presentation.